To the pandemic, you might have come across the term pneumonia, and you might have wondered what it is. And this is what we're going to talk about in this video. Hello and welcome back. Pneumonia is a swelling that is caused by an inflammation within lung tissue, more specifically in the alveoli, which is caused by a pathogenic invasion. Now let's first talk about epidemiology. So annually, around 450 million people, which corresponds to about 6% of the whole world population, suffers from pneumonia, whereby it also causes about 4 million deaths. Those deaths occur more frequently in those who are already vulnerable, like infants and geriatric people, and also belongs to the leading causes of death in developing countries. And it might shorten the lifespan of already very diseased individuals. But what is pneumonia and how is it caused? So actually it's caused by pathogens, which can be either bacteria, fungi, parasites and viruses, whereby bacteria and virus are the common ones. Now, bacterial pneumonia is caused predominantly by a bacteria called Streptococcus pneumoniae, accounting for nearly half of all the cases. Pneumonia caused by fungi is relatively uncommon, but it might occur in those who already have a weakened immune system, for example, if someone suffers from HIV. In general, fungal infections are more common in those who have a suppressed immune system. And when it comes to parasites, usually the lung gets involved secondarily, so there's a reaction to the parasite that then leads to pneumonia. And then viruses, this also includes the coronavirus and influenza. They can cause pneumonia as well. And in general, those infections are milder and they can improve without additional treatment. And now the cause is that the alveoli, so those are the cells where the gas exchange happens, which is necessary for us to get our oxygen. Those are affected, and then the alveoli might fill with fluid, which is depicted here as with this yellow color. Now the phenotype. So as common symptoms we have coughing, which can be dry or also produce mucus, difficulty breathing, fever, pain, rapid heartbeat, and also gastrointestinal symptoms like nausea or vomiting. The symptoms, however, might differ between people and also due to the fact that there are different causing agents. In geriatric people, we might see confusion, and the youngest, they might show very unspecific signs or solely seem restless. So diagnosis isn't always straightforward. I already said it, now let's talk about diagnosis. Usually the clinical presentation might suggest a pneumonia, and this can then be checked via an X-ray, which you see here. And there are actually 4 types of pneumonia: aspiration, community-acquired, hospital-acquired, and ventilator-associated ones. The most dangerous or the most serious ones are those who are hospital-acquired, as the bacteria there might be resistant to common antibiotics. And due to the current pandemic, it's essential to test for SARS-CoV-2. Actually, it might be rather difficult to name the exact cause, and subsequent, also more complex tests are of course feasible, such as an arterial blood gas test or also a CT scan, if the doctor wants more information. Now, what can you do to treat it? There are actually various treatment options which depend on the cause. Your doctor might prescribe you antibiotics for a bacterial cause, and as indicated before, for viral infections, it's usually sufficient to just rest and make sure to get enough fluids. Antivirals, however, are an option. And there is, of course, also additional medication to lessen symptoms like fever and pain. But in general, if any of the symptoms worsen, it's possible to go to the hospital, and there might also be a need to do so. Therefore, it's possible to closely monitor the vital functions and therefore easier to react to any complications which include lung abscess or also a sepsis. The mortality rate is with less than 1% comparatively low, but it might still take a few weeks for the symptoms to resolve completely. And the last word about bacteria and viral pneumonia. Those are contagious, at least the causing agents, and therefore prevention is essential. Those preventive measures might include vaccination against those, agents, but also quitting smoking as the lung is then not as vulnerable, and also an overall healthy lifestyle. So those measures and a generally healthy immune system reduce the risk of getting pneumonia and also suffering severely substantially. This was a quick overview of this disease. If you like this video, don't forget to give it a thumbs up and to subscribe to the channel to see weekly uploads on highly relevant scientific topics. See you in the next video.